I'm swinging my chair to block an unsightly view behind me. I have been reading and watching conspiracy theories against the so-called New World Order, the NWO. In response, I have been defending the emergence of any New World Order and its benefits, because I believe the world needs a silent and salient revolution. Anyway, this is a very poor excuse for making a video on the NWO, as it probably has nothing to do with the NWO. You tell me after listening to what I've got to say. This morning I had a routine blood test, but they would not charge me any money. I had wanted to make sure that they charge my insurance rather than billing me personally. The wonderful phlebotomist in the wonderful state of Texas assured me they were not charging me any money. So could it have been a medical matinee by our beloved governments due to the recent concerns with MERS, also known as Middle East Respiratory Syndrome? MERS was initially discovered in the Arabian Peninsula in 2012. It is a coronavirus which attacks the respiratory system, being in the same group of viruses as the common cold. Symptoms include fever and coughing, the severity of which may lead to pneumonia and fatality and death, kidney failure too. There has also been gastrointestinal symptoms such as diarrhea, and there is no vaccine or any special treatment. According to the World Health Organization, so far there has been more than 570 confirmed cases of MERS, including 171 fatalities. And the number of countries with confirmed cases has so far increased to 18, including a case in the Netherlands. Most of the cases are in Saudi Arabia, apparently, and the United Arab Emirates. The origin of the virus is still unknown, but evidence implies camels, as in a study documented in MBO. Researchers have isolated live virus of MERS from 2 dromedaries. Dromedaries are single-humped camels. Multiple substrains in the camel viruses, including one that matches exactly with another substrain taken from a human patient, a live human patient, presumably. Anyway, there isn't currently any travel restrictions to the Arabian Peninsula. Travelers to the Middle East, especially the Arabian Peninsula, have been advised to avoid intimate contact with camels. No, really. Travelers have been advised by the CDC to monitor their health and watch for any flu-like symptoms and contact the doctor if feeling unwell after the trip. According to the CDC, the first case of MERS transmitted within the United States is being suspected with the infection of an Illinois man, but who is no longer sick. According to the source in the CDC, Dr. David Swerdlow, apparently, the Illinois patient had a 40-minute face-to-face meeting with the Indiana man who has been the focus as the first case of MERS in the US, and who had been diagnosed with MERS as having MERS after returning from Saudi Arabia. A blood test has confirmed the Illinois man's having had MERS infection, having had, meaning no longer having, MERS infection, but who had reported only mild cold-like symptoms, and he had not sought or required any medical care. The CDC believes that the Illinois patient was infected with MERS. Well, he was not a patient because he didn't seek medical care. So the Illinois man was infected with MERS, but technically wouldn't count as an official case because it does not meet. He does not meet the definition by the World Health Organization of an active case, which requires evidence of a live virus. Apparently, US health officials are cautiously treating it as MERS. US health officials have been tracking persons who had close contact with the Indiana patient, who was diagnosed with MERS in the United States on May the 2nd. The case in Illinois was discovered as US health officials have been tracing the movements and contacts of the US initial patient, the initial infectee, the Indiana man who was an American health care provider. Was he a nurse or was he a doctor? I've been wondering, but has been working in Saudi Arabia and who had planned to visit his family in Indiana. He had traveled on April 24th from Riyadh. Riyadh is the capital of Saudi Arabia, to London and then to Chicago. Is it Chicago or Chicago? And then had taken a bus to Indiana. The Indiana patient man had met with the Illinois man for 40 minutes on April 25th, and then followed by another brief contact meeting on April 26th, according to the CDC source, Dr. Swerdlow. The Indiana man then experienced shortness of breath, coughing, and fever on April 27th, according to the Indiana Department of Health. He was then admitted to the hospital in Munster, Indiana, community hospital, Nemours Hospital. On April 28th, when he visited the emergency department there, he has been released from the hospital last week. Health officials then proceeded to test 53 health care workers, 6 family members, and another associated person. The MERS virus, it seems, is displaying a different set of characteristics in the Illinois man who had only mild symptoms, implying the characteristics of MERS should now be presumed more diverse than had earlier been observed. You could have no symptoms at all, according to the CDC source, Dr. Swerdlow. So, do you see any involvement, anything to do with the New World Order in whatever I was talking about? I can only see the benefits of a New World Order in the control of the spread of diseases. We need a New World Order. Viva New World Order!